The national healthcare ICT infrastructure is changing so that healthcare providers and the NHS can use data and information in a more joined-up way. Organisations can harness informatics to recognise trends, improve processes and deliver excellent patient care. The Informatics Skills Development Network, part of the North West Skills Development Network, is providing an innovative learning and development programme.
The health service is overflowing with data, and in the northwest of England, a workforce is being grown to analyse and understand this goldmine of information to help treat patients. Doctors are highly regarded, but according to the Harvard Business Review, one of the most important and sexiest jobs of the 21st century is the health data scientist.
Would you want to be informed that there was a new tablet or a new dose?
These people are studying for a Master's in Health Data Science. They come from all different backgrounds, clinical, non-clinical and private. The course was developed by the Informatics Skills Development Network in partnership with the University of Manchester. The aim of the course is to produce the informatic leaders of the future. Dr. Gareth Thomas is a Chief Clinical Information Officer.
It's given me some fundamental understanding around the principles of informatics and around how the electronic patient record can best be utilised to standardise patient care and deliver more reliable outcomes. I think as well it's also given me an insight into the value of analytics across a population of data, so that as a clinician you can strive to improve the health across a population rather than on an individual doctor-to-patient relationship.
Informatics brings together two main areas: IT people who build computer systems and analysts who extract the data and spot trends. But there's a shortage of people with these skills. The Informatics Skills Development Network was set up in 2011. It provides networking and learning programmes for informatics staff in the northwest of England. It wants the job to be taken seriously at board level.
The NHS needs to sit up and take notice of what's happening in our network. Skills development is hugely important. Technology is moving so quickly that it cannot be ignored. Skills of informatics staff are key to technological change.
University of Manchester is one of 4 centres that has been recognised as a centre of excellence in health informatics, and we are partnering with the only informatics skills development network in the country. I believe that these two institutions really are a driving force to help professionalisation in the field.
In the States, informatics is a medical speciality, but here in the UK it does not have the same professional standing. The ISD network is changing this. It's introduced an accreditation scheme to acknowledge the work of nearly 5,000 staff working in informatics in the region.
If you can say that as a workforce you've been accredited, and if you can push those messages out, then actually it raises the profile of their work, it raises the profile of them as a group of staff, and it impacts positively on the organisation and on the service users and patients.
So what would you recommend?
The ISD network is building a workforce at all levels. These teenagers are part of its informatics apprenticeship scheme. Dave Averberko spent a year at college before deciding this route was better.
The world is entirely digitalised nowadays, and if you want a career in 20, 30 years, it's going to need to be involved in IT. And if I can get the tools that I need for then, now at the age of 17, I'm going to be the best position possible for the future.
The workforce in the Northwest in informatics terms is quite mature because we have profiled it, and we hope that by introducing apprentices into our workforce, we will develop the workforce of the future.
With an ageing population and demand on the NHS greater than ever, it's believed informatics will play a crucial role in sustaining the health service.
I've been a practicing clinician now for 20 years, and I think informatics and clinical leadership offers a huge opportunity to really improve patient care across a wider system and deal with the productivity and efficiency challenges faced by the NHS.